I was feeling pretty good. I was talking with a lot of the staff and we were just joking around and I was feeling pretty good. The pain at the time before the injection was pretty constant and very, very noticeable. And I happen to be one of those people who I actually have an immunity to pain meds. So no painkillers work on me no matter what I try. They take no physiological effect. The euphoria kept up for most of the ride home, I'd say. Eventually, it did subside after a while, and the following day I started taking notes on everything that I was noticing that was different. By, I believe, the second, possibly the third week, I noticed that the pain in my shoulder was only present if I moved a certain way instead of the constant pain that I was having. And as of today, I can move my arm anywhere I want. I can put it in any position I want. And unless I just extremely overuse it, I haven't had any issues with it.
That is incredible. All right, welcome to the Medical Entrepreneur Podcast. I'm so excited to have Tim Pettit with us here today. Tim, can you tell the listeners and viewers just a little bit about your background, a little bit about yourself?
Of course. My name's Timothy Pettit. I am a CCI registered cardiac sonographer is the official term. And I've been doing echo now for a little over 4 years. Echo is shortened term for echocardiography, which is ultrasound of the heart. I've taken on students. I do a lot of work. I've worked in outpatient. I've worked in trauma center hospital setting where I was everywhere from their version of an outpatient room to intensive care units where there's machines everywhere and you had to figure out how to get to the patient. And during that time, I think is when I had stressed my shoulder the most, which it actually is the reason that I ended up doing the PDP.
Yeah, absolutely. So my understanding was that you basically had some shoulder pain, likely from work, which,
Yes.
How often is it that healthcare professionals get injured at work? It's seems like every day, right?
Right. Yeah, ergonomics are nice, but it doesn't happen in real life.
Exactly. And then, trying to move patients around is very difficult, right? So,
Very true.
Basically, you had this injury, and then how did you come to find out about the PDPA technology?
So I came to find out about it because I went to a clinic where I had actually done my clinical hours for ultrasound school, which is medical imaging and therapeutics over in the Villages here in Florida. I went over to talk to Dr. Dr. Jacobson, who he actually is an interventional radiologist, and I wanted a second opinion because the first doctor told me I needed surgery and that was the only option to fix my shoulder. And Dr. J said that was actually the worst thing for me to do in the beginning. It would be better if we tried PRP first, which is a platelet-rich plasma injection, which goes directly into the shoulder. And I had already had one treatment of that where it went into my sternum. And it actually did show some improvement, but for the shoulder, it did nothing. So I talked to him about other options, and he brought up PDP and said this is a new thing, and that his son was involved with a company that handled this type of treatment. And through the course of the appointment with him, I ended up deciding, okay, well, it's fairly new, but all of the information, all of the science that I was reading about it was pointing towards this being a viable option for me to try it out. So I went in. They gave me a shot directly into my shoulder, and then the rest of the dosage went into an IV, which is for a systemic condition that I have, which is it's an inflammatory condition that is called ulcerative colitis. When a flare-up happens, I end up with arthritis pretty much throughout my body, lots of other assorted issues. Basically, it's inflammation of all of the worst parts of the body, and it's pretty miserable. So I decided that I would go ahead and try that out. And directly after the injection, I actually felt really good for about 24 hours or so, which I was told is normal. And I was also told it was normal for that to subside a little bit, and then the body would start to heal itself. And I've been keeping a log, all of the improvements that I've noted, and pretty impressive the results I'm getting. I'm very happy with it.
And so what did you feel, after, so you sound like immediately after procedure, you felt better, but you didn't have any numbing medication put into your joint. You didn't have any steroids. No. It was just the product alone.
Only the product alone. And in fact, I was told not to take any NSAIDs or things of that nature that are typically used to help that kind of condition. And so I made sure not to take anything for, I believe it was month before the PRP, and then when that didn't work, I just kept not taking that so that I could try the PDP, and I noticed an immediate euphoria, which pretty much kicked in right away. I was feeling pretty good. I was talking with a lot of the staff, and we were just joking around, and I was feeling pretty good. The pain at the time before the injection was pretty constant and very, very noticeable. And I happen to be one of those people who I actually have an immunity to pain meds. So no painkillers work on me no matter what I try. Wow. They take no physiological effect. So anyway, the euphoria kept up for most of the ride home, I'd say. Eventually it did subside after a while, and the following day I started taking notes on everything that I was noticing that was different. By, I believe, the second, possibly the third week, I noticed that the pain in my shoulder was only present if I moved a certain way instead of the constant pain that I was having. As of today, I can move my arm anywhere I want. I can put it in any position I want. And unless I just extremely overuse it, I haven't had any issues with it.
That is incredible. So before the PDPA injection, basically, would you say your pain is out of 1 to 10, or was out of 1 to 10?
Before the injection, I would put it easily around an 8.
Wow. And that was constant?
At the minimum. It was constant at an 8. And I've learned to deal with pain. I get made fun of for it, but I watch my cartoons. I play my stupid little games on my computer, whatever it is to keep my mind occupied. But nothing really ever helps.
Man, 8 out of 10 pain constant is really tough to deal with. Like, people don't, unless you've lived through it, it's just disabling. So, and
it is.
And then now, was it 4 weeks later, you basically have no pain? Is that right? Or
I believe it's been a little bit more than 4 weeks now, and I almost never notice any pain at all. If I turn a certain way, because there was I believe they referred to it as a high-grade tear on pretty much every tendon in the shoulder, wow, as well as the rotator cuff. And unless I really overuse it or I sleep on it for a little too long, I don't notice any real pain at all.
Man, that's incredible. And then you had also mentioned that there was, in addition to getting the shoulder injection, you also had an IV, which is typically done with PDPA. They usually give you an injection to the joint, and as well as a systemic treatment. Did you have any effects from the systemic treatment?
So as far as the systemic treatment, what I've noticed is I haven't had a single flare-up of my condition.
And that's ulcerative colitis,
I've noticed ulcerative colitis, as well as gastritis and a few other things that the doctors have been just kind of tacking them on. I haven't had any interactions with any of my medications that I currently take. None of my supplements seem to have any effect on it one way or the other. I've noticed, though, that, and I actually added this to the last note that I sent to the CEO of Novo, where I'm in the process of helping my mother put in a new interlocking floor in her house. And I actually hit my left index fingertip with a hammer and hit it hard enough I broke it open.
Whoa.
And it healed in approximately 1 week. And then for whatever reason, maybe somebody up there just thought it would be hilarious for me to do it again, I literally did the exact same thing a second time.
Oh, man.
And it healed again. And then just last night, I actually bit a piece of my tongue. We were having dinner, and I saw it. I saw it last night when I looked in the mirror, and as of this morning, it's mostly healed over. It's a little sore, but I've noticed my healing has gone significantly faster. Joint pain and muscle pain from putting in the flooring. I mean, I'm 46 years old, so people my age typically don't bounce back as fast as I have, and I'm still a little bit sore on certain things because I have other old injuries that have never been treated. But the muscle pain and joint pain is gone.
Wow, that's incredible. So, and this was with just one round of treatment. Basically, your shoulder was fixed, and your ulcerative colitis, all the flares have stopped, and you seems like you're able to even, questionably have like an increased healing rate.
Yeah.
Wow.
And it's really nice because it gives me that edge that I need to be able to keep up with everybody else, especially in my field.
Yeah.
And the last clinic that I was at, they started me off with going right back to a full load of patients, which was 14 patients per day. And it was a little rough because I was kind of rusty, and so I was a little slow, but I didn't really hurt as much. And by the end of the day, yes, I was a little bit in pain, but not nearly what it had been. And by a weekend, I was able to get right back to my old schedule, and I had no problem.
Man, that's incredible. And so if someone was thinking about maybe using the PDPA technology for their own shoulder or knee or hip or something, what advice would you have for somebody who's maybe interested in that?
Definitely don't take any of the NSAIDs or anti-inflammatories, anything at all like that. And the euphoria, it can be very deceptive. There was a story that was told to me where an athlete had just assumed that the euphoria meant everything was fine, and he went out and played with his grandkids, went to the gym, really overdid it, and ended up injuring himself a little further. But I took it slow, and I let everything heal, and I have no regrets about it. I'm currently putting money aside so I can go get one more treatment before the year's out, just to give every possible edge to myself to really get everything healed up as much as possible. And my intention is to keep it up as an annual treatment.
Man, that's wise. And it's funny because I actually use the PDPA's IV every quarter, so roughly about every 3 months. And I actually use it because I feel like it does give you the euphoria, which is I find it to be kind of pleasant.
Yeah.
But but the thing is also I feel like it increases my cognitive ability. But I wanted to share with you this. See if I can do this on this screen here. So here's actually just a picture of the difference between all the different regenerative products. So the PDPA is here is this blue one. This is the number of factors that are in the PDPA. And then the purple one here is PRP, by the way. So you can see this
there it is.
It's like so much different than PRP.
It really is. And it is a noticeable difference. That's one thing I can definitely attest to, is that between the two, it is a noticeable difference, because I had the PRP before, and it did work. I was having a lot of pain with an old injury to my sternum, and it did work. It's just it didn't work nearly as well as what I've noticed with the PDPA.
Yeah, the PDPA by far is the strongest thing that I've ever seen in regenerative medicine. I mean, this is what I used to use here, this yellow one, is Warden's Jelly. Okay. So back in the day, we used to use this quite a bit, especially for orthopedic things. And it was okay. I mean, it did a good job. It helps people, but there's nothing. I mean, this is like orders of magnitude bigger than.
Oh yeah. Absolutely.
So,
it is that noticeable to anybody who's listening or watching. It is absolutely that noticeable. You have to be patient though, and you're not going to immediately jump off the bed and say I'm cured. It's it's a ongoing process. But as I mentioned, at one point I was taking notes every day, and now I'm down to every 3 or 4 weeks I'll add an extra note and make a remark about all of the noticeable differences that I've found, and the major reduction in pain and the increase in healing has made a major difference for me.
Man, that's huge. And as somebody who's already in medicine, you're obviously involved in doing echoes, reading people's, heart studies, interacting with patients. Yeah. Do you feel that the world has actually heard about PDPA enough, or do you feel like it's kind of like a hidden gem?
No. The closest thing to this is stem cells, and that's the only thing that people actually understand when I try to explain it to them, and they say, "Well, but I still don't get it." And just like when I explain what an echo is, I can throw the whole textbook at you, or I can find some way to put it in layman's terms that anybody will understand. And the term that everybody is more familiar with is stem cells, and I just tell them it's very much like stem cells, only different. It's a different process, it's a different product, but it is very much the same in terms of that type of technology. And that's where a lot of people will smile and say, okay, that makes more sense now.
That's a great way to put it, because a lot of the PDPAs, the protein arrays that are released, by stem cells, especially mesenchymal stem cells, basically are very similar to what the PDPA technology is.
Well, and most people understand stem cells in terms of that is a regenerative medicine. That's how they understand it, because most people are not science majors. They just don't think of it that way. They might be an accountant, or they might have been an artist. They don't understand biomechanics. So it's easier to just use the terms that have been publicized over the last several decades. And stem cells is one of the easiest ones that they understand right away.
Man, that is amazing. Well, I was also hoping to ask you a few questions, if it's okay, regarding just some ultrasound things, if you're okay with that. One of the things that we've been seeing a lot with our PDPA treatments is that we have a lot of people that report a lot of micro tears, as well as partial tears, so partial thickness tears.
Okay.
And so one of the things that we see on ultrasound is that we often are able to detect these micro tears if they're big enough. We can actually see them on ultrasound, and we'll treat them with the PDPA technology, and then return about 2 to 3 weeks later, and we see that the micro tear is gone. Based on your experience in using ultrasound and echo technology, is that a reasonable assumption to assume that the ultrasound would be able to tell that the tissue has changed?
It can tell the difference on tears versus healthy tissue, and in addition to that, you're going to have all of the normal physiological responses like swelling. Well, that would be in the form of edema, so we would see either an increase or a decrease of the accumulated fluid in that area, and that would show as an anechoic area, depending on where the tear itself is. And at least on my own shoulder, I was able to track a lot of it. Because it was a work system, I of course couldn't save any of my images, but I was able to look at it and track it and see that the swelling and the other inflammation of the area was actually being reduced. And it was approximately every 4 to 7 days that I would see a noticeable difference.
Absolutely. Well, I would think it's something that I think is, your skill set's very useful in talking about this, because one of the things that I see in medicine is that, the great thing about ultrasound is that its technology and its price point has dropped significantly over time. Like, I remember getting my first ultrasound, and I think it was like $30,000, and it was on a cart that you had to wheel around, and even transporting that thing, we had to have a truck to put it in. Like, and now
I've used one,
and those echo ones are even bigger. So, but now,
they used to be.
Yeah, and then now the ultrasounds, like I have a little ultrasound probe I can carry in my backpack. I use an iPad as my screen. And it's like, that's all that I need. And so it's just amazing the technological ability that people have now.
Absolutely. And I've actually got a couple of friends who have those exact types of units where it's it's just the probe and the software is loaded onto their iPad, and they go to Belize and various other countries on missionary trips, and they'll use it on people that just would never have the ability to get those scans done in the first place.
Yeah.
And it's amazing what technology has become these days.
It's very, very true. That is incredible. So it sounds like for you, I mean, did you have any side effects from your treatment? Any downsides or negatives?
No, nothing that I've been able to notice. I think the closest thing to a negative was I made the remark to Dr. J that, gee, it'd be nice if that euphoria would stick around for a little more than a 24-hour period. But other than that, I haven't noticed any issues whatsoever. I have noticed that the repair has been happening in the shoulder. The muscle is when I'm working is regularly sore, but that's because I was off for a few months, and so it wasn't getting used. And I intentionally I wasn't using it at all. I would keep it immobilized as much as possible so I could give it a chance to heal. As I would scan, it would get sore, but that was just the muscle soreness. And then that would go away by the following morning, sometimes even that night as I went along. So that was another part that maybe I just didn't notice how quite as fast, when it came to the healing factor of it, is even then it was healing the muscle soreness, which was, just normal from suddenly being used again. And I didn't realize that that's what was going on.
Yeah, that's awesome. One of the other things that we see with the PDPA technology, I'm just going to share the screen with you if that's okay. So here's this is the screen. This is page 1 of 2 of what's all the stuff that's inside the PDPA technology.
Yep.
And I think
I went through all of those.
Yeah, here's 2. Yeah. I think this is page 2, or maybe this is page 1 and that's page 2. But you can see there's quite a bit of stuff in there, And so one of the things that, we've seen over and over is that with the PDP technology is that it seems to interrupt existing cytokine inflammatory cycles. So whether it's, rheumatoid arthritis or even osteoarthritis has been identified recently as having these cycles as well. But basically these kind of inflammatory cycles where cytokines are released, it stimulates an inflammatory response for the body. That inflammatory response then stimulates additional inflammation, usually through either direct tissue attack, in the case like rheumatoid arthritis, where the body's attacking the joints, and ulcerative colitis, where that's happening on the intestinal epithelia. And then basically that stimulates the cytokine release again, which is this kind of cycle where it's self-perpetuating. And we see whenever we do, especially systemic treatments with these things, that it just stops that cycle completely because it has all of these pieces into it. Would you feel like that's what may have interrupted the ulcerative colitis that was going on?
Well, and I remember reading all of the paperwork really and everything I could find through Novo, and of course Joe, the CEO over there, sent me a bunch of extra information, and then I started reading through all the case studies. And that's where I would have to agree. I'd have to say that is that makes the most sense, is that the treatment was able to interrupt the cycle enough that it stopped being a cycle. So, like I said, I still haven't had a flare-up since. And for a while there, I was having almost constant flare-ups. It would start up a little bit, and then I would just have to deal with it. And I found multiple ways to deal with it, but this time I haven't had to worry about it coming up with another solution because nothing has happened. I haven't had any real issues. Of course, I do follow certain very strict dietary changes. There's certain trigger foods that I know to avoid. There's certain other things that I know to avoid, but even when I do avoid them, I would still find myself in a situation of maybe it would still be there, maybe it won't. But ever since having the IV treatment, I haven't I haven't noticed any signs whatsoever.
Man, that's incredible. And for so many people with ulcerative colitis, there's just no easy solution to stop that.
No,
And
nope, not at all.
How would you describe, without PDPA technology, just like some of the medications that are out there for ulcerative colitis? Do you feel like any of them are ultra effective?
Not for me, and for most of the people that I've met, whether they were a patient of mine or just someone who it just somehow came up in conversation, what I would have to say is every medication that's out there that works has, well, and oddly enough, it goes with the old joke of, every medication has even worse side effects than what you already have. And one of the worst things about some of the medications that I was on when I was initially diagnosed was severe nausea, to the point where I didn't want to eat, because if I ate anything, then I would immediately get sick.
Wow.
And in addition to a handful of other very, very intense other issues. And I actually lost a good number of pounds in the course of finding out what this really was. And even the medication, it just didn't help. And I had to come up with other solutions. I was eating candied ginger by the bag, trying to keep the nausea under control. I was trying to keep myself going. But the more I did to self-treat, the more the medication would get increased. In order to keep the symptoms under control, I had to keep taking more of the medication, and the more medication you take, the worse the symptoms.
Yeah, exactly. That's exactly what I heard before from so many people.
Yeah, and they would just give you other things that would, it would help you with the nausea, but then one of the side effects would be gastrointestinal cramping or sudden urge to make a run for the restroom. So it just went in a vicious cycle, and it got to that point, and I said, okay, on top of all of that, I'm also paying thousands of dollars per month for that medication, and it gets bad. That's the best way I can simplify it. Is it gets bad, and then it gets worse. And as I went along, I realized there are certain things that I could and could not eat. There are certain things that I could and could not use to treat certain symptoms. And it's been a mess.
Yeah. And this is what I see with a lot of the autoimmune, medications, because just like you said, it's a classic story where people say, do I take the medication knowing that the side effects are often as bad, if not worse, than the disease?
Exactly. Exactly.
So, and then like you mentioned before, none of them are very cheap. They're usually all very expensive. So,
extremely so. And that causes a major problem on its own. Because if you don't have insurance, or you don't have good insurance, well, now you're trying to decide, well, do I pay my rent or do I get the medication?
Wow. And that's so sad that so many Americans are at that place.
Yeah. And it's a lot of people. I've actually talked to a good number of people from the UK and a few other places that have had the exact same comments to say about it. Is the medications that are so specific, they only treat that one thing. Look at insulin. That's the perfect example. Look at insulin. And people are having no choice but to pay insane amounts of money, or they die.
Exactly. For something that is so cheap to manufacture,
Exactly. And I'm sure you've heard the story too about the person who invented the process for making synthetic insulin, sold the patent for $1 because he wanted it to be affordable, and now look where we're at.
Exactly. Big pharma again,
Yeah, unfortunately. But I am very happy that I've found something that has actually worked. Usually by now I've had at least one full-blown flare-up that I've had to deal with, and haven't had a single issue.
Man, that is so great. Well, Tim, thank you so much for coming on the podcast and sharing your story. I really appreciate it. And your message will go and help many doctors and other patients also just realize that this is perhaps an opportunity or a technology that may be useful for those people that are suffering. And we need to regenerate, a certain joint or a certain tissue, or if we need to suppress, some kind of inflammatory cytokine cycle, that this may be a choice for them to use.
Yeah, things like lupus or rheumatoid arthritis that has progressed throughout the entirety of their lives. There's all sorts of people out there that have full systemic problems that this really could help.
I think you're 100% right. Well, thank you so much for your time, Tim. I really appreciate it. And thank you for coming on the podcast.
Absolutely. Thank you, Doctor.